Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Posture and Wellness Clinic. Let's talk about the one joint that no one wants to touch or think about. That's your pubic bone. Yes, so stay tuned. I notice in my practice is a lot of times people come in and there's that one joint that no one even wants to get close to because they're probably afraid to get sued, which is understandable. And that's your pubic symphysis. So with pubic symphysis, can I have that spine here for a second? So with pubic symphysis, that's part of your pelvis, comes together to form your pubic bone. So on this model, this is one half of your spine, of your pelvis. This is the other half. In the front, they come together. There's a cartilage right there. And this, by the way, is your pelvis and your spine. And this right there is where the hip joint, the femur, the thigh bone becomes a ball, and the ball sits in this socket. So pubic symphysis is that part of my one half of my pelvis, and this half come together, the socket, the hip goes right in there. So you have an understanding what the anatomy looks like. There are like a ton of muscles and ligaments attached to this, and ligaments, you've heard of pelvic floor and all that stuff. So the pelvic inlet, if I were to open this up, there's like a whole bunch of ligaments and soft tissue that is keeping this together. This is so important. Your inner thigh muscles, that's your quads, your inner thigh muscles, your quad, your vastus lateralis, a whole bunch of gracilis. We don't need to go over the muscles here, but they're all, the integrity of those muscles play a huge role in the positioning of your pubic symphysis. So imagine if you have a tighter inner thigh on one half of you, on one side more than the other. It's going to yank one half more than the other. It's going to change the positioning of your pubic symphysis quite a bit, which means the problem is now going to transfer over to the opposite side. I hope this is making sense. So how do you address it? That's the part that when you have issues, you go to a doctor's office, a chiropractic, a clinic that does rehab, or physical therapist. No one gets close to it. Hey, we're not doing anything funky here, but that's just another joint, just like your elbow is or your wrist is. There's no shame behind that. So be aware of it. No one talks about it. And I decided to do this video just so you know. I'll try to come up with other videos where you can palpate yourself. Let's just say if you were strategically palpate your pubic bone area, you will actually be sore. Not necessarily on the top, but on the really private parts. So I can't wait to get comments on this one, but anyway, just wanted to bring awareness to you. That's the purpose of this video. We'll do other videos on how to treat it. We'll find a victim as a patient for that. Thanks for watching. Make sure you subscribe to my YouTube channel. Check out my podcast, Life and Health Ladders with Dr. Shakib, and this was a fun video. Take care.